Hi, my name is Mitch Ziegler. I'm a physical therapist at Arbor University Physical Therapy. And today we're going to be shooting a video of good posture techniques while you're sitting. And this posture technique is actually something called the pelvic clock, okay? So this technique is, I teach it to most of my patients, and it's very good just to know where you are in space when you're sitting and how to hold your body and actually how to decrease the amount of stress and work that your body has to do, okay? So here we go. So I want you to pretend like you're sitting on a clock. So right in between your legs is going to be 12 o'clock, back here will be 6 o'clock, over here is going to be 3 o'clock, and over here is going to be 9 o'clock, okay? So most of the time people sit with their tailbones resting on 6 o'clock. So I'll move the chair for a second here. And so if you can see this, I'm falling back into this 6 o'clock position. When I sit in this position, it's a hard workload on the body. My body's curved and kind of rounded forward. We have these things in our back called discs, and we have vertebrae in our back, and that's what makes up the spine. So these little discs that are in between the vertebrae, what's happening here is there's a lot of pressure being put anteriorly, and it increases the pressure posteriorly on the disc. So there's a chance that this can create some injury or it can wear down the posterior aspect of the disc over time. Also, when we sit like this, we're smushing down our diaphragm here, so we can't really get a good breath in. So if you were in choir or anything like this, you're told to sit up nice and tall and open up your diaphragm. But when we sit in the 6 o'clock position with our tailbone resting on 6 o'clock, it actually smushes it down so we don't have as much use of the diaphragm. Also, the ribs have a tendency to collapse down onto the lungs and onto the heart too, so there's a decrease in cardiac output in this position. Also in this position, when I sit in this 6 o'clock position like this, when I go to move my arm, what happens is that I get a pinch in my shoulder, because what happens is the shoulders are rounded forward and it changes the mechanics of the shoulder. So that creates a pinch, but when I sit up in a normal neutral position, I can move the arm really freely, okay? So the pelvis has actually changed the biomechanics of the shoulder by me sitting into this position down here like this, in the 6 o'clock position. Also, what happens too in this position, when I sit in 6 o'clock, my head comes forward like this. So when I fall into the 6 o'clock, my head naturally comes forward and gives me an anterior head positioning. So what happens then is the muscles from my back of my neck all between my shoulder blades have to work really hard to hold my head from falling forward, because right now my head doesn't have a good base of support. Okay, so the 6 o'clock position is really hard on the body. So the other position is when you move into the 12 o'clock position. When I move the front of my pelvis down towards 12 o'clock, I get this movement forward, which creates and changes all of my spine completely. It puts me in a much more upright position. My diaphragm's open up, my shoulders are sitting back, my head's resting right over my cervical spine. But what happens down here in my low back is we have these little joints that are between the vertebrae. And those joints, they like to have so much motion or so much space in there. And when I come way up into this 12 o'clock, it kind of smashes them together. So it creates a lot of discomfort from smashing the facet joints. Also, there's a lot of work in my erector spinae muscles have to do to stay into this position here like this. So this is a really hard work position on the body, the 12 o'clock. The 6 o'clock is a really hard work position on the body, what we talked about earlier. So what should we do? Well, we should fall right into the middle, so right in between the 12 and 6 o'clock. And if you look, it puts me in a pretty much upright posture. When I'm in this upright posture, it's actually the least amount of work my body has to do to maintain this posture. So when I start to fall into this position like this, into the 6, my body has to work really hard to keep me from falling forward. When I sit way up into this 12 o'clock, my body has to work, especially in the low back, really hard to try to get into this position. But right here, if I can balance in this position with not a lot of muscle contraction, I can just sit in this position with the least amount of energy, okay? It's called the 12 o'clock position, or it's called the neutral position. So we have 12, we have 6, and we have the neutral. So every time you sit down in your chair, you should do 12 o'clock, 6 o'clock, and find that neutral position. And just get in the habit of every time you sit doing that, and that way you'll learn to find this position. So there's also the other positions we talked about, which are 3 and 9 o'clock. So if I shift my buttocks all the way to the right side, this is the 3 o'clock. If I shift it all the way to the left, this is called 9 o'clock. If I put it right in the middle, this is called the neutral position. Okay, so the same things apply here. when I tip this way, I'm squishing the disc over on this side. It puts more pressure on the disc this way. All my muscles have to contract really hard on this side to try to maintain this posture position. Everything gets thrown off in this position. It's a hard work position. And of course the same on the other side. So that neutral position from right to left is the least amount of work, and the body just prefers this. So every time our body sits, every time you sit down, do 12 o'clock, do 6 o'clock, find that neutral position, then do 3 o'clock, 9 o'clock, and find that middle position and just settle into this position like this. So let's say you do that, and then all of a sudden your back gets tired or whatever, and you want to use the back of the chair. What should you do? So you move your bottom back, you do 12 o'clock, you do the 6 o'clock, and you find the neutral, and you only lean your upper back into the chair. This is the way we use a chair, leaning our upper back. We are not, we should not sit with our low back resting in the chair, because that is the 6 o'clock position, okay? So again, we want to go to 12 o'clock, go to 6 o'clock, find the neutral position, and just lean our upper back into the chair and just rest in that position. And then in this position, if you notice that your back is getting uncomfortable or tired, you can do this rocking forward into 12 o'clock and rocking back into 6 o'clock. And by doing this, we're actually massaging our disc. When I push my body into the 12 o'clock, it squeezes the back part of the disc. When I go into the 6 o'clock, it squeezes the front part. This is actually a way to massage the disc, okay? And remember, when I said we will go way into 12 o'clock, it jams the facet joints. Well, when we go back into 6 o'clock, it opens the facet joints. So you're kind of mobilizing your joints back there, and you're also massaging your disc just by doing that little movement. And our bodies aren't meant to sit for a prolonged period and not doing anything. Our bodies are meant to move even when we sit. So doing this, rocking back and forth, rocking forward and back, is a great way to do movement with sitting, and I highly recommend it. So, a quick review. When you sit your bottom in a chair, just do 12 o'clock, do 6 o'clock, find the neutral position, rock to the right cheek, rock to the left cheek, find that neutral position, and then your body is completely in the neutral, which is where you want it to be. And then if you want to use the chair, just lean your upper back into the chair. Okay, so that is the pelvic clock technique. It's a great technique if you have back pain. It's a great technique just to learn how to find that good neutral position so your body doesn't have to work so hard. And I think if you work at this for a couple of weeks, it'll become an automatic part of what you do. So I hope you enjoyed the video. If you look at the description below, the number for our clinic will be there, so you can call for any questions. And please look at some of the other videos that we've posted on our channel. So have a great day. Thanks for watching.